As we wrap up Heart Health Awareness Month, we still have a lot of questions. So we brought in an expert, a real doctor, Dr. Trivedi from Inova Hospital. Thank you so much for joining us. Of course, you're a cardiologist. You're an expert in cardiovascular health. And we still have some questions. We've been kind of exploring this topic all month long. So thank you for joining us.
No, it's my pleasure. Thank you for having me.
What does it mean to have good heart health?
Well, heart health, when you talk about heart health, one of the things I always start with is heart disease. So what is, heart disease? And there's a lot of different kinds of heart disease. Um, the most common one we always think about when we hear that term is what's called coronary artery disease. It's where you have blockages in the heart arteries, the ones that feed blood to the heart muscle. And so when we talk about heart health, what we're talking about is what can you do to prevent that process from happening? There's a lot of pieces to that. Heart health, it's kind of a lifestyle thing. It's not just one single thing. And a lot of it is the stuff that you've heard about over and over. It's, eating right, avoiding foods that are high in saturated fats, those unhealthy kind of fats, avoiding lots of carbs, not smoking, watching your weight, those kind of things. But there's also a big part of it is knowing your numbers. Okay, that's a phrase we use a lot. And those numbers are things like your blood sugar, your blood pressure, your cholesterol numbers. There's all these different types of cholesterol, and it can get confusing. But knowing those kind of things can be very helpful in guiding what you as an individual should be doing or what you should be avoiding.
So the big question that we got earlier in the week, we had Wendy Rieger on from NBC4. She had open heart health, surgery last fall. And a lot of women especially came to me and were like, how do you know when to see a cardiologist? Like, I think I have a little flutter, or I know my blood pressure's high, or it was high the last appointment. Like, how do you navigate when you go see a specialist outside of just seeing your general practitioner?
Yeah, and that's a great question, and it can be very confusing. I've been in practice 20 years, and I'm still trying to give advice to people on exactly how to do that. I'm with a practice called Virginia Heart. We've been partnered with Inova for a number of years, and like you said, this is what we do day in and day out, and it can be difficult. I think if you have risk factors, if you have, and the big risk factors we talk about are things like diabetes, blood pressure, high cholesterol, smoking, and a strong family history of heart trouble. If you have those kind of things, starting with your primary doc is a great place, to begin. You can talk about those risk factors, the things you can do to reduce those risk factors. When you start having symptoms, more than just risk factors, but you start feeling something different, that's when it's a good idea to at least talk to your primary doc about, should I see a cardiologist? Sometimes if they're really mild symptoms, a very brief flutter, um, you know, a little bit of, say, shortness of breath, you can start with your primary care physician. If you start getting really intense, severe symptoms that come on very quickly, that's the kind of time you want to just go to the hospital. You don't want to necessarily talk to your doctor in their office or wait, days for an appointment. If it's sudden and severe, you want to just go straight to the emergency room, let them check you out and see what's going on.
Doctor, we're all kind of feeling a little funky these days, I think, with the pandemic, and maybe we're not eating as great as we should be, or maybe we're a little more stressed than we used to be. What are some of the warning signs that are like the red flag warning signs that you should be worried about? That's not necessarily the go right to the ER pain, but things that people should be keeping track of.
Sure. When we talk about heart symptoms, the classic thing we talk about is chest pain, right? And that's true in a certain percentage of people, but everybody's a little different, and everybody's symptoms for the same disease people can have different symptoms. Okay. So chest pain, the elephant sitting on my chest, that's the classic textbook thing you hear about, but it can be a lot more subtle than that. It doesn't necessarily have to be pain. It can be discomfort. It doesn't have to be in the chest. It could be in the neck or the jaw or the shoulder. One thing that tends to be fairly common is those types of symptoms that get worse with activity. So, if you notice something unusual, and when you're working out or when you're going out for a walk and you feel it more during those times, that's when bells should start going off in your head that, hey, maybe something funny is going on. It can be even more subtle than that. Some people just feel like they're running out of gas. Like, 6 months ago, they could walk up this hill, no problem. Now they get halfway up and they're just short of breath. They don't feel like they can do it anymore. That could be a warning sign for cardiac disease.
I want to ask you, this is like a working theory, and I'm a daughter of a doctor, an emergency room doctor, so I know enough to be dangerous. My dad had a stroke in his 50s. I'm in my 40s now, so I'm just very aware of heart health, take my own blood pressure. My blood pressure has increased during the pandemic. It's elevated. It's not high. my general practitioner and I are on a working theory because I exercise, I'm not overweight, I eat well, that it is the sodium, because I've been doing more carry out than more normal, that perhaps it might be the sodium intake is kind of triggering the high blood pressure. I'm wondering, as if you've seen that over the last several months, is that something that you believe to be true, or am I just like grabbing at straws and I just have an elevated blood pressure?
No, it's certainly possible. I mean, the majority of high blood pressure is just genetically driven, right? You come from a family with people with high blood pressures, there's a good chance you're going to have high blood pressure. But there are a lot of things that can make it higher. They can make it higher in a short span of time, and certainly sodium is one of them. So if you eat a lot of salty food, particularly over and over for a long period of time, that tends to drive up your blood pressure. So that's not a myth. That's actually reality. And one of the pieces of advice that we give to people with high blood pressure is to really count the amount of, measure the amount of sodium that they're eating, read the labels. We try to recommend, sort of 2,000, 2,500 milligrams of sodium a day. And that sounds like a big number, 2,500. When you start counting, you're going to be shocked at how quickly you get to that number in the course of a typical day. And there is absolutely a link there. During COVID, everybody's more stressed. We know that stress and blood pressure are connected. Some people who used to go to the gym regularly now aren't going to the gym, and it's winter, so they're not necessarily exercising. So, increased stress, increased salt, less exercise. It's not surprising. You're in the same boat as a lot of people. Their pressures tend to drift up a little bit during those times.
How are we doing as an area? Like, I'm sure you talk to other doctors like around the country. How does the DC area rate? Because we always are on those like super healthy lists and that
Right.
sort of thing.
Right. I mean, it's hard to know the exact demographics. It can vary a lot from community to community. I think the DC area has got a lot of younger people, and younger people just in general tend to have a little bit less heart disease than folks in their 70s and 80s. So I think as a region, we do pretty well. Whether it's because we're healthier or just because we're younger, it's hard to know for sure. But there are a lot of fitness conscious people in this part of the country. There's also a lot less smoking around this area compared to a lot of other parts of the country. And we know there's a very close link between tobacco use and not just heart disease, but lung disease, cancer, all these kind of things. So, I think overall we do pretty well as a region.
And it's hard to have a cigarette when you have a mask on.
Right. That doesn't stop some people, but people find a way.
That's true. Well, okay, so I love that. Know your numbers. That's a good way to start to know your heart health, your cholesterol, your blood pressure, and all those things. So, Dr. Trivedi, thank you so much for joining us and reminding us about all those things. It's so great. In February, we talk about this stuff, but it really should be kind of part of our daily routine.
No, it's my pleasure. I'm glad to be here. And just one other quick thing, during COVID, people have been very scared to go to the hospital. They think they're going to be exposed to COVID there, and they have symptoms like the ones we talked about earlier, and they try to convince themselves that it's not their heart, that it's something else because they're too scared to go to the emergency room. Please don't do that. We see too many people coming in, a week after a heart attack when damage is done. Our ability to help at that point really goes down a lot if you come in too late. If you come in early, we can nip things in the bud. We can intervene quickly and really prevent any damage. But if you come in and a week after the event, we have a lot fewer options. So please don't ignore symptoms. Don't be scared of COVID. Get the care that you need if you're having symptoms that you find worrisome.
That's a really important PSA there, because I haven't heard that from a doctor before. So thank you for that little piece of information.
It's my pleasure.
Dr. Trivedi from Inova Health, thanks for being a part of the show today.
All right. Thank you so much.